Welcome to our presentation on multiple endocrine neoplasia, MEN, syndromes, presented by Professor Wadie El-Madhoun. By the end of this session, you will be able to identify the scope of MEN syndromes, classify and differentiate between the various types, and describe the pathological lesions and organs affected in MEN1 and MEN2. Multiple endocrine neoplasia, MEN, refers to a group of inherited disorders characterized by the development of tumors in multiple endocrine glands. These syndromes are caused by germline mutations and follow an autosomal dominant inheritance pattern with variable penetrance. MEN1 is associated with chromosome 11, while MEN2 is linked to chromosome 10. This genetic distinction is crucial for understanding the different types of MEN syndromes. There are three major types of MEN syndromes: MEN type 1, MEN1, MEN type 2, MEN2, which is further subdivided into MEN2A and MEN2B, and MEN type 4, MEN4. Each type has distinct genetic causes and associated tumors. MEN1 is characterized by tumors in the pituitary, parathyroid, and pancreas, while MEN2A and MEN2B involve different sets of tumors, including medullary thyroid carcinoma and pheochromocytomas. MEN1 is caused by mutations in the MEN1 gene on chromosome 11q13, leading to tumors in parathyroid glands, pancreatic endocrine tumors, and pituitary tumors, with prolactinomas being the most common. The clinical features of MEN1 include hypercalcemia due to parathyroid hyperplasia or adenomas, and symptoms related to hormone secretion by pancreatic tumors, such as peptic ulcers and hypoglycemia. MEN2 syndromes are associated with mutations in the RET proto-oncogene on chromosome 10q11.2, leading to a different set of clinical manifestations compared to MEN1. MEN2A is characterized by germline mutations in the RET gene, leading to medullary thyroid carcinoma, pheochromocytoma, and parathyroid hyperplasia. MEN2A involves primary hyperparathyroidism, pheochromocytoma, and medullary thyroid cancer, each contributing to the syndrome's complexity. Clinical features of MEN2A include neck mass or symptoms of hypercalcemia, and hypertension due to pheochromocytomas. MEN2B is caused by specific mutations in the RET gene, particularly affecting codon 918, and is associated with more aggressive medullary thyroid carcinoma, pheochromocytomas, and mucosal neuromas. The clinical features of MEN2B include early onset medullary thyroid carcinoma and gastrointestinal symptoms due to ganglioneuromas. This diagram provides an overview of the organs affected by different types of MEN syndromes, highlighting the complexity and variety of tumors involved. MEN4 is caused by mutations in the CDKN1B gene, encoding a cyclin-dependent kinase inhibitor, and presence with MEN1-like features but with a different genetic basis. The pathogenesis of MEN syndromes involves the loss of function of the menin tumor suppressor protein in MEN1, leading to uncontrolled cell proliferation, and RET mutations in MEN2, driving cellular growth and transformation. MEN1 is the most common and usually inherited from a parent. MEN2A affects approximately 95% of people with MEN2, while MEN2B is a rarer form. MEN4 is extremely rare and often caused by hyperparathyroidism. The morphological features of tumors in MEN syndromes include medullary thyroid carcinoma with amyloid deposits, parathyroid hyperplasia or adenomas, and pheochromocytomas with Zellbelin architecture and salt and pepper chromatin. Medullary thyroid carcinoma and parathyroid adenoma are two significant conditions affecting the thyroid and parathyroid glands. The images show the histological patterns of these conditions, highlighting the differences between normal and abnormal tissues. Multiple endocrine neoplasia, MEN, is a group of disorders that affect the endocrine system. This slide illustrates the different types of MEN, including MEN1, MEN2A, and MEN2B, and the associated glands and tumors. The diagnosis of MEN1 is based on clinical, familial, and genetic factors. This slide outlines the criteria for each basis, emphasizing the importance of family history and genetic testing in identifying at-risk individuals. This illustration humorously depicts the symptoms and affected organs in MEN1, MEN2A, and MEN2B syndromes. It provides a visual summary of the conditions and their impact on the body. Thank you for your attention. We hope this presentation has provided valuable insights into medullary thyroid carcinoma, parathyroid adenoma, and multiple endocrine neoplasia.